Hello, everyone. It's Charlton. Please subscribe to my channel. Tap the notification bell. I'd appreciate it majorly. So, just wanted to kind of go over this hydroxychloroquine drug that's out there, and I'm just, I don't know, man. I think I'm getting pretty good at this. I really do. And I think I got Trump's number just about nailed down, man. Boom! Nailed down. And, I've known this for a while, that the reason Trump is like, why he came up with fake news and all that is because he's the master of it, dude. I mean, he is the master of media and fake media. Totally. I mean, that's why he thought of that. Okay, because he knows it like nobody else. Okay, so and it's funny because I've been looking at this, but and I saw this story here, and it just kind of brought. And I've looked at these things, and it just kind of sent me down this path, anyways. But I'll mention this first because people do die. I mean, it's terrible. So I don't want to make a bigger thing out of, be overly dramatic. And people die all the time of all sorts of stuff. It's just a fact, But there's a story out there that a couple, I think in their 60s, I believe they're in Arizona. They took something that is like a derivative of chloroquine, and it's like chloroquine phosphate is what they took, which is just like an additive that you use for your fish tank. But because I guess of what they've seen in media reports, and I don't know. I don't know if they're Trump supporters or not. I don't know if their names are even revealed in here. But they took these things thinking it would prevent them from getting coronavirus, and the man they both ended up in the hospital, and the man died from it, and the woman is in critical condition. I mean, the couple, both in their 60s, were hospitalized after ingesting chloroquine phosphate, an additive often used at aquariums to clean fish tanks. The man died, and his wife was left in critical condition as a result. It is believed that they confused the chemical with hydroxychloroquine, an antimalarial malaria drug that's shown promising results in treating coronavirus patients. I'm not going to spend a lot of time on that. I'm just saying that, there's real life consequences to saying things that maybe aren't true, And I'm not here necessarily, I'm not a scientist, all right? I'm just here to tell you what I find, and things that I find suspicious. I do, okay? And even when I saw this report of a couple of cases of people that basically have said this drug, the malaria drug, saved their life, two of them in particular. There's a guy in Florida, and there's a woman in New Jersey, and they're both in this article here. And I don't know. I just found it odd. A number of different things. And the president mentioned one of these in the beginning of his press conference today. It was one of the first things he brought up was this guy who says he was basically, saying to his family his goodbyes, and he thought he was, death was certain. But a friend had told him about this malaria drug, and so he convinced his doctor to give it to him. And, overnight it basically saved his life. That's what he says, And there's another woman who basically, went to the hospital for and was being treated for coronavirus, and I think on oxygen or something like that, had severe pneumonia and coronavirus, and was given the med, hydroxychloroquine or Planaquil or whatever the hell it's called, and she felt better afterwards. So, and she's in here as well, and that's kind of the one I'm looking at right now. And it's not so much her story as it is the person who reported on it from Forbes. That's what caught my attention for sure. Because I just was wondering, like, how did that reporter find this person, or even this guy, dude? I mean, who found this dude, or exactly? I guess. I don't know. I mean, I'm sure they could have called the media outlets themselves, and because of the circumstances they did, maybe. The reporter says in her report that she spoke to her in her hospital bed on her cell phone, as she's basically kind of still recovering but feeling better finally. And I'm just wondering, how did this reporter from Forbes find this one patient? I mean, how did that happen? So, but when I was looking at the report, here it is right here. This coronavirus patient dodged a bullet with hydroxychloroquine. Is she a harbinger or an outlier? And it's the reporter. Her name is Mary Beth Pfeiffer. I think is how you say that. And she's written a couple books. Her main book, I think, is on Lyme disease and how climate change has. If I could summarize or paraphrase, how climate change has caused the incident rate of Lyme disease to increase, and how Lyme disease is underreported and not dealt with properly by our medical system, something like that. She's very liberal, extremely, okay, which is just fine. I'm against Trump at this point, even though there's tons of conservatives I still like a lot. I'm believe me, if I hung out with people and partied with people, I'd be probably, it really wouldn't matter. But I'm just telling you, I like conservatives. I used to consider myself a conservative. I am a conservative. She's very liberal though, which is just fine by me. Believe me, super liberal. She's a journalist, So, but not just. I mean, she's pretty far left, So, anyways, and I'm not going to read through this giant thing, but she does say she spoke to her on her cell phone. She gives her story, blah, blah, blah. And she says she shared her medical records with her. I don't doubt that she was given, hydroxychloroquine or whatever the drug is that is for that, Plaquenil. Plaquenil. There it is right there. So, let me just read through it real quickly so I don't get it wrong. Margaret Novins talked to me on her cell phone. The very first sentence. There you go. Margaret Novins talked to me on her cell phone from a hospital bed at Center State Medical Center in Freehold, New Jersey. She had been ill since March 8th, toughing it out through fatigue, a cough, and fevers that brought on vicious chills for 5 evenings straight. Finally, on March 15th, she went to an urgent care center, and on March 16th to an emergency room. The attending there called it conversational dyspnea. I couldn't breathe, she said. Novins, who shared her lab test and medication list, got her diagnosis March 19th. Next to the entry for SARS-CoV-2 were the words detected critical. She had the coronavirus, or COVID-19. To that point, Novus had been a pneumonia patient for 3 days, treated mainly with antibiotics, but within an hour, a new drug was added to her med list, hydroxychloroquine, a decades-old malaria-turned autoimmune drug, also called by its brand name Plaquenil. President Trump is touting the drug, some say overselling it, as the possible answer to COVID-19 crisis. Novins responded to the treatment. She was better, though surely not well the next day. The fever, which was still spiking when she was on other meds, is now gone, which is fantastic, she said on Saturday, March 21st, coughing at times but able to speak. And it goes on. It continues. So, again, I repeat, how did she find this patient? I wonder that. But what struck me is just that, it's Forbes, and she's she just has a very, very liberal background. That doesn't mean Forbes doesn't have liberal reporters for them. But what also struck me is that she just started writing for Forbes. Just started. Her most recent, her most oldest article is from February 26, 2020. Okay, right in the heat of this crisis, basically. Okay, right around the beginning of it. So she's not doing any reporting for them until just February 26, 2020, and just 4 articles later, she lands on this one and somehow mysteriously finds this woman, that took the drug, the hydroxychloroquine, that seemed to, cure her when she was, in the height of her sickness, seemed to have a pretty severe case of it, pneumonia, in the hospital for 5 days. I don't even know if I got the details right. That's pretty strange, don't you think? I don't know if you're seeing, this is a very liberal reporter, okay, writing for a publication whose founder, or I think Steve, is it Steve Forbes? It's Steve Forbes. I think he's the heir of Forbes. Maybe not. I think so. I don't think he was. I think he's the son of the founder of the Forbes. He's a billionaire, I think. He's super rich, and he's on Fox all the time. I know Steve Forbes. I kind of like him. He's a conservative, and Forbes is a pretty conservative, thing. So why is an ultra-liberal journalist, author, mysteriously just gets hired by Forbes on February 22nd, 2020, right at the beginning of this crisis, and is seemingly kind of coming to the rescue of Trump, with this whole hydroxychloroquine drug, with a success story, a very happy story, and that seems kind of weird to me. It just does. And it seems kind of like, I don't know, dude. Trump's the one who's always saying fake news. And like I just said in the very beginning, the reason he says that is because he is the master of it. So, it kind of cracks me up. He hired him, or Forbes hired him. But that's a big publication, That's a pretty big, pretty big business. And, it's like, he just... The people he follows, he's got 228,000 followers. He's a frequent guest on Fox. He's a rich dude, and he's a smart dude, and he's ultra conservative. He's like flat tax, basically super limited government, and his most recent follower is that chick, is that woman. When you look at her, her Twitter account, it's all journalists and journalism, and things of that nature, and all liberal politics, But she follows him now too, and he follows her, So, and she, these things don't necessarily, she's from New York. I didn't mention that yet, but that's part of where my antennas went up. She's from, I didn't even look up Poughkeepsie. I know she wrote for the Poughkeepsie Journal at some point in her career, and she follows Hillary and Chelsea pretty early on. This is SUNY New Paltz. That's what is that? State University of New York, in New Paltz, or of New Paltz, which is basically sort of upstate New York where she's from. Her husband was a professor there for 30 years. Okay, and but retired back in 2013. That's what this article is right there. And I'm just trying to kind of give some time frame reference of when she followed Hillary Clinton. Hillary Clinton was the senator of New York, and Chelsea Clinton right after her. But her husband was a professor at this university for 30 years, but retired in 2013, 7 years ago. So her account was created in 2009. Basically, I'm thinking she's following, them around that time, around 2009. Not much long after that, she follows the First Lady, the former First Lady, actually. It's FLOTUS, but she's not following Melania Trump. That's back when FLOTUS was post 2009. So it would have had to have been Michelle Obama. That's when Michelle was the First Lady, as well as, FLOTUS 44. No Barack Obama, though. No Barack in here. Believe me, I looked up and down. I'm just saying, sure, I get in her profile is, Hudson Valley. That's, the Hudson River near, in upstate New York, upstate New York-ish. I know upstate New York a little bit. I have family from there, definitely. Spent some time there visiting family, a lot of my life. The Clintons are from Chappaqua. I don't know where Poughkeepsie is. I'll do that right now. Look there. Wonderful. There it is. Oh, it's whatever. It's in what's that say? It's 50 miles away. I guess that's walking or something. I don't know what that is. That's the bus. Anyways, it's an hour away. So she's from upstate New York. She's from around an area around, I think, where Chappaqua is. I don't know. I just got the feeling, this has got Hillary Clinton's fingers all over it, dude. And you know what I think? I think that Hillary Clinton and Donald Trump fixed the 2016 election. I think it's so strongly, man. So strongly. And that she lost on purpose. And they've been working together all this time, dude. Including up to right this very moment. All right? Why is this liberal journalist getting a job from Steve Forbes at Forbes magazine on February 26, 2020, okay? Right in the heat of this crisis and right before it's about to explode in the States, and then 4 articles later, she's coming to Trump's rescue to report on a success story of hydroxychloroquine, which Trump's been talking about for the last 4 days, and pretty much no physician out there, except I'll show you one who says, there are, and she has several scientists that she talked to in her article, sort of defending that it's worth giving it a try. And it very well may be. I'm just saying the oddities of the circumstances that I've pointed out to you, I think are legitimate for me pointing them out to you. So, over in this other article with this guy, which I don't need to recirculate that too much, other than in this article at some point there's some other doctor, an oncologist. Why they go to an oncologist, which I think is a cancer doctor, to get an opinion on this is beyond me, but they do. And his name is Dr. Paul Sung, and he basically says that, a lot of people were walking around shedding, blah, blah, blah. He basically says it sounds like it's promising and we should give it a try or whatever. Oncologist Dr. Paul Song said while using hydroxychloroquine to treat COVID-19 is still preliminary, it's extremely compelling and hopeful with such an infectious virus. A lot of people are walking around shedding viruses unknowingly, and if you can't eliminate this from the body in such a short period of time, then the potential to infect others is greatly diminished. I read that wrong. A lot of people are walking around shedding viruses unknowingly, and if you can't eliminate this from the body in such a short period of time, then the potential to infect others is greatly diminished. I think he meant to say if you can eliminate this from the body in such a short period of time, not can't. Maybe he was misquoted. So I wasn't reading it wrong. So, but the strange thing about it is that when I looked him up, okay, again, the reason I looked him up because I saw he's an oncologist. He's not like a virologist, an epidemiologist, or whatever, infectious disease doctor. I saw it says his spouse is Lisa Lang. I'm like, Lisa Lang. And that's actually, that's the chick on CNN. That's the chick who's got her own show, This Is Life on CNN, all right? And if you think Trump doesn't have influence over CNN in some ways, and through some channels, believe me, you're full of baloney, because he does. And I've talked about this. I'm not going to go into this at length, but in other videos, I've talked about an individual, a billionaire activist investor. His name is Paul Singer. He's the founder and head of Elliott Management that took a huge position in AT&T some time ago, asking for changes to be made at the organization, asking to have his people put on the board and so forth. And one of the major changes he wanted to do is he wanted AT&T to divest some of its assets or break it up. One of its assets is CNN. And so if say you have somebody there, I think it was a $3 billion position. I don't exactly know what the compromise was, I'm not a privy at those kinds of things, obviously. But if you have somebody there, who's got a show that could very easily be canceled, and that's just kind of like a show that airs on Saturdays or whatever, maybe it wouldn't be a bad idea for that person, if that person's spouse, if they happen to have a spouse that's a physician, to make a positive comment on Trump so that their show doesn't get mysteriously canceled. What do you think? So, that's pretty much the extent of what I want to revisit this very quickly before I go, though. Okay, and I've read through this study pretty well. The study that everyone's talking about with this French infectious disease guy. I forget his name, and I pronounced it wrong the last time. Didier Rault. So, because there's several things that are flawed in this study. They just are. Besides the fact that it's so ridiculously small, and one of the big things is it's not. You hear this term randomized. It's not. It's got to be randomized, and it does. Because what physicians do, randomized basically means it's either randomized or blind. I don't have time to figure all these things out, just doing the best I can. But basically what happens is doctors, because they're just like you and me, they're human beings, all right? And we all want to be right. We're all obsessed with being right. It's so important to us, it really is. And if you can figure that out, you figured out a lot. You really have in life. If you can figure out that we're all just sort of flawed and we just love being right. We just love the power of being right. But because of that, physicians, they have a tendency, if they're doing their own test, if they're testing their own hypothesis, they'll just want the data to prove what they think is right. Okay? And that makes it flawed. It always does. And you just can't help yourself. And that's how this was. It wasn't randomized or blinded or whatever the hell it's called. In any event, okay, and it was only, it started out as a 42 person sample, and then it got reduced to 36 because 6 people basically were removed from the trial, and 6 pretty critical people, if you ask me. I'll review that very quickly because I did that in my last video, and that's just, but that's pertinent to what I'm talking about of these 2 people, or else I wouldn't repeat it again. But one of the things I notice in here is it says, of the patients that were part of the trial, 6 patients were asymptomatic. That means they had the COVID-19 disease, but they weren't sick yet. They had it, and they weren't showing symptoms yet. They weren't sick. They weren't suffering. They weren't coughing. But in another part in the study, it says that it says the patients. See the patients, the word patients right there? Patients. Hospitalized patients with confirmed COVID-19 were included in this study if they fulfilled 2 primary criteria. And then it continues. And now, I could be, missing something, and it could be that, I don't know, that there were some people included in the study that were not hospitalized. But this says patients, and then it says hospitalized patients with confirmed COVID-19. So why was somebody who was asymptomatic, who didn't have any symptoms, who wasn't sick, was in the hospital? Why is that? And 6 of them. That doesn't seem to add up to me. Okay? The last thing I will, just to review this, was, like I said in the previous video, that 6 were removed. And they were 6 of the worst. If you read the study, that's what it says. When you read why they left, it's basically 3 of them went to the ICU, 1 of them died, and 1 left the hospital, and 1 was so nauseous that he didn't want to do it anymore. Something like that. I think that adds up to 6. It does. And, basically what I'm telling you is it seems like, and I'll read that just so you don't think I'm crazy. It seems like they were some of the worst cases, some of the people that were on the verge of, not recovering, and they left the study altogether. So we don't know what happened. We don't know, we just don't know. But they were some of the worst cases. And what I'm saying to you is these 2 stories of these people, the guy, one, he works for he sells commercial oven equipment or something like that. The guy in Florida and her, he said he was worse than her. But what I'm saying is they seem to be some of the worst cases too. And in the study, it seemed like some of the worst cases didn't even finish the trial. I don't know. I thought it was worth mentioning. But just so that you know that I'm not 6 hydroxychloroquine treated patients right here were lost in follow-up during the survey because of early cessation of treatment. Reasons are as follows. 3 patients were transferred to intensive care unit. That means they were bad, including 1 transferred on day 2 post-inclusion who was PCR positive on day 1. 1 transferred on on day 3 post-inclusion who was PCR positive on day 1, 2, and 1 transferred on day 4 post-inclusion who was PCR positive on day 1 and day 3. So all the people, they still had the disease and up until they left, and then they weren't left the trial, and then they don't know after they left the trial, but they went to the intensive care unit. One patient died on day 3. On day 3 post-inclusion and was PRC negative on day 2. So he became negative, but he died anyways. And then one decided to leave the hospital and was PCR negative. And on days 1, 2, finally one patient stopped treatment on day 3 post-inclusion because of nausea. And I mean, one of Dr. Gottlieb, I'm not going to play it, but in this interview here, and he was basically saying, of all the trials out there, they should be tried. I'm just saying the fact that Trump has honed in on this one thing, and is trying to build it up and give people probably false hope as that this might be our golden ticket. I don't buy. I think he's foolish. He is foolish. But Dr. Gottlieb here is saying he's a former FDA commissioner, I guess under Obama. But he was basically saying that of the trials out there, he doubts if that's going to be the one. He thinks something else will emerge as the best option. But it will still be months. It just will, because it just takes time, even with the hydroxychloroquine, But one of the things he says in here is that, they just test the nasal. They do a nasal swab or something like that to indicate whether it's PCR positive or PCR negative, and if the viral load went down, it's just testing this area, and that doesn't necessarily test the full condition of the person, and that's why, like here, this could be saying, it says PCR negative in here, but he died anyways, okay? The one who stopped but was PCR negative on day 2, but day 3 died. And that's, that's the story there, man. That is the story there. Thanks for watching my videos. Please subscribe to my channel. Give me a like down below. And I'll see you in the next video. Later, man.